the risk is they might just say, well, in 2 weeks' time, I'm going to be able to do whatever I want anyway, so I'm not going to be vaccinated. So it may reduce the likelihood of their hitting those very, very good, very, very high vaccination targets. The other issue, of course, is there's the risk of opening up is not just an even risk across the whole population. As I said, kids under 12 will not be vaccinated, so they'll be at much higher risk of being exposed. There are going to be communities where there haven't been access to vaccinations, rural communities especially. So it is going to be a very uneven set of risks. And, white, Anglo, middle-class people like myself are now fully vaccinated. It'll be okay for us, but for the low-income people, their families, their workers who are travelling around, they're going to be the ones at risk. And so we've got to really worry about what happens in those communities.
Yeah, Stephen, one of the things we didn't learn today was once the 80% target is hit and people can travel freely through the state if they're fully vaccinated and cases are expected to jump, how do authorities respond when there is an outbreak? Because lockdowns seem to be off the table now.
Exactly, and the health system in New South Wales is not in a good shape just at the moment, especially in some parts of Greater Sydney. So, as I said, it's a very risky strategy. We're seeing the problems of stress on the ambulance system, the problems on stress in the emergency departments. So, I think the government is hoping that people will continue to be vaccinated and this will solve their problems. And I think the fact that we're seeing a downturn in cases in New South Wales is the effect of vaccinations that's bringing the number of people getting infected is coming down. But we've got to continue on that trajectory, and that's the critical policy issue.
I guess one of the other impacts of separating the vaccinated from the unvaccinated in the rules and what you can do is you've got to be able to check if someone's vaccinated. It seems like this is going to fall onto the business owner, which seems kind of like an unpleasant thing for them to do and potentially confrontational given what we've seen the anti-vaxxers do in the protests in Melbourne.
Yes, the anti-vaxxers spat on nurses who are actually doing their job delivering vaccinations. It was just a disgusting display. And so it is a risk that the businesses will say, look, I've done enough, I've checked the QR code, unless you've got a system which actually beeps or something like that. So when the QR code is scanned, you're checking your vaccination status already. And there's talk about that, but we actually haven't seen an operational version of that. So I think it is putting a big burden on businesses to do this checking.
I'm also wondering what the future of QR codes is once December the 1st happens. Do you think we'll become less diligent in using them?
I think so. It is, there's a big trade-off here about QR codes. It's a breach of privacy, and potentially QR codes have been used for things that weren't supposed to be. They're supposed to be only for about contact tracing, that we've seen in a number of states that the police have been accessing for other reasons. So I think my preference would be, as soon as it is safe to do so, we move away from the use of QR codes. They should still be in place. That can be turned on instantly, but in my view, it'd be better for us all if we have less surveillance and less risk of breaching of that surveillance.
Is it fair for the unvaccinated essentially to be left behind here? Or, as Barnaby Joyce just said earlier, if you haven't got the vaccine, that's on you. You've got to get yourself vaccinated.
Yeah, I'm not as callous as the Deputy Prime Minister, because, at the moment, there is still a problem that not everybody can get access to the vaccine. It's not going, the Commonwealth Government, of which the Deputy Prime Minister is part, stuffed up the vaccine rollout, didn't buy the right vaccines back in the middle of last year. And so we've still got communities, especially in rural Australia, still got communities that can't access the vaccine. We've still got communities. So, it's not their fault. And the second point is, we're talking about kids here under 12, not their fault. And also there are some people who, for medical reasons, can't be vaccinated. Not their fault either. So, as I said, I'm not as callous as the Deputy Prime Minister in saying these people who, for no fault of their own, are not vaccinated should be left to their own devices.